Okay, today we are going to talk about pandemic surveillance. And in our next lecture, we will discuss and I'll share with you some new approaches to prediction modeling of pandemics and outbreaks. Public health informatics and technology is abbreviation FIT, and its a great challenge of FIT is to detect and predict infectious disease outbreaks and pandemics that threaten the lives and well-being of our citizens. But what causes disease outbreaks? There are several causes. For instance, weather conditions, exposure to chemicals, exposure to radioactive materials, natural disasters such as storms, earthquakes, droughts. Then, of course, environmental factors like air quality and wastewater and other factors, environmental, that impact the disease outbreaks. But what causes pandemics? Once a virus jumps to people, it can rapidly spread through the population because of our behaviors. Through blood, hepatitis virus, for example, sexual interactions, it is HIV, eating norovirus, or through the air, such as COVID-19. Droplets we create when we cough, sneeze, or speak. We take 12 to 20 breaths in average a minute while resting, and we share each other's air. COVID-19 virus is characterized by the ease with which it spreads between people. It takes a day to fly from Beijing to New York, and you see how it's an airborne virus may easily spread across the globe. Once it enters a community, an airborne virus spreads because of our nature. We live in crowded cities. We love to go to parties. We love to go to bars, restaurants, movie theaters, and sporting events. Examples of pandemics are influenza pandemic 1918, Asian flu 1957, Hong Kong flu 1968, H1N1 2009, HIV/AIDS 1981, and COVID 2019. The objectives of pandemic surveillance, and pandemic surveillance actually supplies data and information for making predictions about the likelihood of infectious disease outbreaks or pandemic, and how the disease will spread and how we can control it and monitor it. Pandemic modeling and forecasting rely on statistical methods to make probabilistic predictions from real-time data. And real-time data is a very, very important operation, and COVID-19 demonstrated that it is one of the most important elements of making our work much more efficient when we work on the data modeling using, for example, COVID-19. The world was actually unprepared for the 2019 coronavirus disease pandemic caused by the novel virus, when the disease was first identified in Wuhan, China, and in December 2019, resulting because of our unpreparedness in millions of deaths. Public health informatics and technology combines computer science, statistics, and epidemiology. Its objective is to early respond to public health threats and increase the efficiency and effectiveness of prevention actions. Surveillance is a pillar of the public health response to outbreaks and pandemics. To address current vulnerabilities demonstrated by COVID-19, and COVID-19 showed us a number of weaknesses and vulnerabilities. The health emergency preparedness, response, and resilience, we call it, is HERP. So the HERP technology calls for a new approach to surveillance that aligns traditional tactics with new initiative to safeguard the health of our communities. In our previous lectures, we discussed in detail discussed digital epidemiology, how to collect data, how to store the data we collected. But today I would like to talk about some novelties in pandemic surveillance and what should be done to make it more efficient. So this is the scope of our talk today. Disease surveillance, as we know from previous lectures, we just remind you that infectious disease surveillance is an important tool to monitor disease burden and epidemiology of disease and detect outbreaks and pandemics. Infectious disease surveillance can have different approaches based on the epidemiology and clinical presentation of the disease, including many traditional forms of surveillance, as well as innovative approaches that we are going to do today to focus our presentation. And one of these extremely important action that actually COVID-19 dictated and demonstrated is a dissemination of surveillance data, because without dissemination, surveillance doesn't make much sense. So we have to collect the data, to store the data, and try to disseminate this data to interested parties, so those who are working on pandemic and outbreak data. One of the novelties of the dissemination of surveillance data is new platforms that build. It is online platforms that actually tremendously decrease the time between the data collection and action actually that we take. And one of the examples of these new platforms is a dashboard or platform, online platform built by WHO. It is World Health Organization, and many people who are working on outbreaks and pandemics and infectious diseases using the data. We use this platform on a daily basis because it is well presented. They present the data is very well, and it updates all the time. So this is very good in terms of also not like locally, but give you a global picture of spread and the dynamics of the outbreaks and pandemics. So what the vision is, central to this vision is the understanding that detecting infectious threats begins in communities and links to multi-sectoral and multidisciplinary integrated approach. And this is exactly what FEED, Public Health Informatics and Technology, supports actually this vision. So this is just multi-level structure. It starts with communities, and then it embraces a multi-sectoral and multidisciplinary approach to better respond to various challenges in public health. Digitization of public health has also led to advances in the use of large volumes of open source data, known as big data, and is a part of surveillance activities. And big data has become a very valuable element of data collection, data storing, and data processing. So during the COVID-19 response, open data initiatives, such as Google, for example, Mobility Trends, offered important insights into population mobility that were highly valuable for risk assessment and monitoring of behavioral responses to public health. Other evolving technologies in FEED, in Public Health Informatics and Technologies, are artificial intelligence and machine learning algorithms, which offer opportunities to use the latest advances in data science to improve our understanding of the complex factors that drive outbreaks and pandemics and to better predict these events. Our current ability to process big data in a real-time manner has the potential to greatly increase our knowledge of the dynamics of pandemics. So an example of this action and this initiative is the platform that we built under the Office of National Coordinator, ONC, Workforce Development Program. So we built a platform that actually it is one stop shop platform that has data, real world data, public health data, big data. We have also algorithms for batch and real-time processing of data, and we trained nearly 150 so far students who actually not only got acquainted to fundamentals of public health informatics and technology, but now they can work with real world data and process big data with real-time or batch processing. They know where, for example, to use batch, where they can use real-time. And of course, this is quite important thing, because using big data with real-time processing significantly shorten the time of our processing. Because if, for example, you have a very nice algorithm, but it runs for a few days, or it has some problems with when you have big data coming with high velocities in some kind of data repositories, of course, it won't be very helpful to us. So we need to train, and we need to have professionals who knows how to use big data in real-time processing. This is very, very important. One thing is also I would like to tell, because today we discussed some novelties and some things that may improve our algorithms and approaches to data processing for better understanding dynamics of outbreaks and pandemics. And this one, this element is genomic surveillance. So genomic surveillance, the availability of real-time genomic information, can be also very important technical asset in pandemic surveillance. Now, public health informatics and technology can now track the evolution of a virus and see how genetic changes are associated with the epidemiological situation and severity of the disease. Genomic epidemiology has also established its importance in monitoring, for example, Ebola, COVID-19, influenza, antimicrobial resistance, monitoring, for instance, multi-drug resistant tuberculosis, and so forth. So genomic has to be included in the pandemic surveillance, because it is a quite important element. What I would like to tell you something, that people who are working, so for example, from public health departments who are working with data that tumbling in a high velocity, high volumes, and we call it as big data. Also, it's important that these big data usually have a great number of different features, because there's lots of features that might impact the dynamic of the outbreaks and pandemic. As I said, it is environmental data, it is it is social determinant of health, it is HIE, EHR, and so many features. And what happened is that machine learning plays an important role in that, specifically feature engineering. Feature engineering come from different algorithms, for example, random forest. So what happens here is that when you do feature engineering, which is actually feature selection, you can find out of so many features, it depends on the problem, of course, only a few that play important role. So other features can be just dropped. And so we use feature engineering all the time when we have many features because we don't want to spend time and our resources for the various features that do not play significant role in the finding, understanding of the dynamics of outbreaks and pandemics. So we use it. And for example, when we used feature engineering to identify the severity of COVID-19 illness, we found only 5 features out of many that actually play the most important role in understanding evaluation of the severity of COVID-19 illness. It is number 1, it is a number of viral particles. Number 2, infectious path. Number 3, it is immune status. Then it is viral strength. And finally, number 5 is genetics. So these factors, they play the most important role in the severity, and we got this result from feature engineering. So pandemic detection, timely detection of potential outbreaks and pandemics is the first step towards subsequent verification, risk assessment, and response. Pandemic surveillance begins with training public health workers to use modern detection system. And modern detection is based on technological innovations in FIT. Specifically, I would like to underscore here is the use of web services. We know that web services is equivalent to application programming interfaces. And we know that the use of application programming interfaces is exactly is the core of the digital revolution that has given rise to novel possibilities to significantly improve and make our data processing much more efficient and decrease time of processing and decision making. So that is application programming interfaces. Now, another thing is also very important, that we found out other sources. We know there is many sources in when we do work on dynamics of outbreaks and pandemics, but one of the sources very important is the social media. And social media platforms help us a lot when we try to give an accurate, complete picture of the dynamics of outbreaks and pandemics. And we do, and other teams also do lots of work on that. And we found that it is extremely valuable tool, the assessment of the sentiment analysis and to analyze the messages in social media platforms to get a complete picture of the problems that we are looking for. Now, another thing is we also have mobility data. For example, mobility data come from smartphones, for example, and this mobility data was used already during COVID-19 to understand overall compliance with public health and social measures aimed for limiting people's interaction to reduce human-to-human transmission and spread of the disease. But this is not totally what I would like just to say, that since we have new sources, we have new technologies, we also would like to tell a very important thing, that besides our advances in working with outbreaks and pandemics, we need also to build an aggregator. So the aggregator is an algorithm, and our activities also to combine other sources besides, for example, mobility data and social media platform. And this one is very, very, we believe it is important because actually we do not have much work going on, but the potential of this work will be enormous. So we would like to think how to integrate to human surveillance. So, for example, for outbreaks and pandemics, also animals pandemics, because it is estimation that over 70% of emerging pathogens have an animal origin. These include avian and swine influenza viruses, animal coronavirus, Nipah, Ebola virus, and among others. So we need also to integrate the human surveillance, pandemic surveillance, with animal, and also pandemics, and also, of course, to pay more attention on environmental data and data coming from social determinant of health, because we need also to improve also this data exchange with social determinant of health organizations. So I would like just to conclude that pandemic surveillance, we made big strides in that during, for instance, these recent years, but the use of big data in real-time processing, then it is, as I said, it is artificial intelligence, machine learning, and also important natural language processing. So I would like also to talk about natural language processing next lecture, when we will talk about prediction. Then we have, of course, advanced algorithm for real-time processing. And then we have a new algorithm for data interoperability. And this data interoperability based on RESTful API with the FHIR protocol. FHIR, it is Fast Health Interoperability Resources. And of course, we need to also to strengthen and to build new aggregators, including social determinant of health, genomic surveillance, animal pandemics data, and environmental data. All right, thank you.